Welcome to the next episode of the Braekthrough Autism podcast. I am super excited to have here today Dr. Julie Koudys, faculty at Brock University, longtime clinician, over 20 years in the field. Welcome, Julie.
Thank you for having me. I'm happy to be here.
Thanks for being here. So 20 years, Julie, looking to expand and grow the capacity. You've been around for a long time. What brought you into the field of ABA?
That's actually an even longer story. But I actually was the babysitter of one of the management staff at the Association for Community Living in my hometown during high school. And there were always people who'd been receiving supports from community living at birthday parties, barbecues, any type of family event. And I just really liked my interactions with folks that were there at the parties. And I thought this was sort of a satisfying, interesting path I could look into. And from there, I had two jobs in my high school and early university days. One was working as a counselor aide at community living. So I worked in a single residential home in a neighborhood community, and I supported the day-to-day sort of skills and functioning of the people who lived in the house at the time. And my other job was as an activities coordinator, and that job was at Tangway Place, which is a nonprofit organization dedicated to supporting people with physical disabilities. And that job was really more focused on planning outings and activities based on the feedback of the clients. So if people wanted to go to the theater in Toronto, if they wanted to go gamble in Niagara, those were the things I did. So I was 18 and I was driving a bus with about 6 wheelchairs in it, which when I look back to now, I can't believe that was actually acceptable, but I loved both those jobs. And it really gave me a sense that I would like to be in a helping profession. I would like to have a job where I felt as though I could interact with people, help identify their goals, and help them work towards them. From there, I wasn't sure what the path should be. It wasn't really a straight line at that time. And I had this love of all things health and fitness and mental health. And so human kinetics seemed like the right choice. So went down that path for my undergrad and my master's, and then was fortunate enough in my master's to do research at the Children's Hospital of Eastern Ontario. And that was on the pediatric oncology unit. And that research was really looking at how could we teach some very specific behaviors, some very specific skills to children undergoing treatment for cancer that would help make those procedures less difficult, although clearly there's going to be difficulty regardless, but maybe less painful, less aversive in the moment. So we did lots of progressive muscle relaxation, breathing techniques, imagery, changing channels. And that work was based on Dr. Terry Orlick's Positive Living Skills program from the University of Ottawa. And eventually that was funded through the province, through a Trillium grant. And we started to disseminate that resource as a free resource to various professionals across all kinds of service sectors. So I was back working kind of in organizations and agencies that serve children with special needs. We were working in recreation centers, so it was kind of filling that my cup sort of in that area of fitness and health and exercise. We were working with people who were working in more mental health centers. And that kind of got my toe back into this world again of people who have different needs and different goals in life. And so after a couple of years of doing that, the program was moved sort of into this off-site program located near the hospital that was brand new in the province called the Preschool Autism Program of Eastern Ontario. And at that time, all these little children were coming into this building, many who started out not communicating, started out having difficulty transitioning, and then I'd see in weeks, months, all of a sudden, children talking, coming in without difficulty, running in and greeting their therapist, so excited to be there. And I just started to ask questions because I had been working with adults with intellectual disabilities, some who also were on the autism spectrum. And here I was seeing these little children coming in with diagnoses of autistic disorder at the time and gaining all these skills. So I was pretty intrigued, asked about the research about it, asked about what they were doing, found out that it was applied behavior analysis, learned about the difference between that and what I'd been introduced to in my earlier career, which was behavior modification, and just started to get really interested again in how this could be used to really support children's development and sort of more stability within families. And then I had to figure out how to get the knowledge necessary to do this thing. So I took a job. I finished my contracts for the other project and took a job with the preschool autism program at the time. I think that's when you and I met as trainers in the province. And eventually took on a clinical position where I had my own caseload of children that I supervised and worked with the team, and I loved it. And just kept thinking, I am only as good as what I know, and I want to know more. How do I do that? And there were two paths at that time in the province. So the first path was to do the University of Nevada, Reno.
I know that program well, yes.
Yep, they came, set up a satellite program. So many people who I admired were taking that program or were planning to. But I'd had a master's already, and I'd been working under this amazing clinical psychologist at the time in Ottawa. And she was really supportive of the consideration of doing a doctoral degree in psychology. But I was so worried about losing the ABA piece at that time. And she pointed out to me that there was another pathway. And so at that time, the Behavior Analyst Certification Board, the BACB, so the sort of gold standard for credentialing, they were creating an alternate pathway in association with the Ontario Association for Behavior Analysis. And that's how I ended up kind of blending my love for both of those things, where I did my doctoral degree in clinical developmental psychology under the supervision of a clinical psychologist who was also a behavior analyst, Dr. Adrian Perry, and did the alternate pathway to become a behavior analyst. And I've sort of stayed there and loved it since.
Amazing. It's incredible. Your story in terms of experiencing individuals in need, developmental disabilities, intellectual disabilities, seeing what it's like when you don't really get optimal treatment. I mean, to put in context at that time, right? Like when we were starting in our careers, never mind even prior, there was very little really that existed, right? In terms of opportunities for individuals to skill build and learn in very specialized ways. So, of course, the outcomes to that were now these individuals grow up and very limited skills means limited opportunities, et cetera, et cetera. To see that and then to see also in your career littles at the time, but really ultimately, I know as you progressed in your career, being able to apply this wonderful science to individuals and see the impact that it can make. It's really striking, right? Like I've seen that too in my career where I tell people like I've really have seen firsthand what it's like to experience evidence-based, meaningful treatment and what it's like to not have that.
Yeah.
Right?
And I think that comparison for me was one of the things that drove me to be motivated to learn, to gain more education, and to stay in the field. I had been working with adults in residential settings where my job was really to facilitate a lot of daily support sort of activities. Toothbrushing, dressing, toileting, ensuring that everybody had access to, healthy, hopefully tasty meals, although I was helping cook them and I was 19, so I'm not sure what they actually tasted like. But our jobs at those times were really to support people through their day. I can specifically remember working with one adult gentleman, and he didn't have a communication system. We had some pictures around, but no structure to actually help him learn to use those pictures independently to get his needs met. And I remember he would go and sit at the dining room table so quietly, and it was a busy household, and he would just hope that at some point one of us would notice him there, and then we'd come and start to do the Van and White. Would you like this? Or would you like this? And hope that we would land on something he wanted. I'm not convinced we did. I think at some point he probably gave up thinking this foolish girl is never going to figure out what I want. I better take something before she gets tired of asking. And so that really impressed upon me the idea of communication. And then seeing these littles, all of a sudden using pictures. The first time a child communicated with me with a picture, because they didn't have spoken language at the time, they eventually went on to develop it, but didn't at first. The first picture they handed to me was of a hug. And I kept thinking, I'd been working with people who couldn't ask for water or food. And here, this young child can ask for comfort. He was upset. His favorite therapist was supposed to be there. I showed up instead, was clearly disappointed, and
No,
very
it's nothing
appropriately,
personal. It's
yeah,
nothing personal.
very appropriately,
Yes.
and knew me. I wasn't a stranger. I had been there a lot, just wasn't supposed to be on the schedule.
Yeah.
Asked for a hug. I think the other thing that has really stuck with me was that in those initial jobs, one of the first things I learned to do in my position was to actually catheterize a woman who was in her late 30s, 40s, had not been properly toilet trained. Again, I'm a late high school, early university student and had received proper training. But every night, this person was being subject to a very intimate act that somebody else did. And then I started working with these young children, and we were, really positively toilet training them using lots of positive approaches and strategies. And they were toilet trained and wouldn't have to put themselves in those precarious positions as they move forward. And I think those safety types of skills, we know people who have whatever forms of disabilities who rely on other people to help them, they're at risk for different forms of abuse. And I just remember thinking, if we can do this when children are young and we can do it in such a positive fashion, what a gift and what a change for their family and their life trajectory. So it was really where I think those were very stark contrasts that really kind of have stayed with me over my career.
That's so true. It's amazing that you brought up communication and toileting. Those are like my top two, too. What really, one of the first hooks for me was actually as well a little boy I was working with, my first client I learned ABA with, and we introduced the picture exchange communication system, PECS. He was nonverbal at the time. And I remember the trials upon trials of teaching him to ask for things he wanted. And I still like it's like etched in my memory. Like I remember the day that he independently exchanged a picture for a toy that he wanted and going, wow, like this really works. Like that's it. I was hooked. And it was the power, right? The ability for him to be able to express his needs and his wants, have self autonomy, to be able to do that for himself, right? To be a part of that is like, it's an incredible gift that our field gives. And the other one for me too is toileting, hands down. And to think about the adults, and I've seen them too. I never worked with them directly, but I have been to various residential homes and different places, group homes, different settings, where there's 40-year-olds in diapers. And knowing what we know and the little kids that we've worked with, and then even now since, teens and whomever else needs it, like I think it's criminal, to be honest. Like it's a human rights issue. There should be no individual with developmental disabilities in diapers. We have the ability, never mind other procedures that you may have to use. We have the ability to teach every individual to communicate, whether it's vocal or not, and also to be independent in the bathroom. These are, we appreciate, you would never think of these kind of things, in your everyday, you take them for granted. So it's amazing that those are the similar things that have stuck with you that really make a profound impact on your career early on, and you're right there directly experiencing it. It's just incredible, which has led you to continue to practice and now do research, be faculty. To get there along the way, I'm sure you've had, and we've talked about this, but it'd be really interesting for people to hear some of the people that have impacted you, the mentorship. What were some of the key pivotal moments in terms of guidance for you in your career that really helped propel your career forward?
This question I always find tricky because I'm so worried I'm going to miss people, because I feel I've been really fortunate from starting early in my career, influences in high school up to influences. One of the more difficult things I did recently was speak at a memorial for the dean of my faculty at Western, Dr. Bert Taylor, who was just this wonderful influence in my life from the moment I think I stepped onto campus at Western. And he sort of guided me through each stage of my career, whether it was from finishing my undergrad and thinking, I haven't gotten into medical school. I didn't do the thing I wanted to do. I've been working towards, and my life is over. So dramatic. And really him sitting me down and having a good conversation about, well, what do you want to do? What was the appeal? What's an alternate pathway to get there? So really helping me make my next choice is to move into my master's, and then being fortunate to work with Dr. Terry Orlick, who was really working at building resilience in children and was doing it through sports psychology, but wanted to make the approaches that we use with children that sometimes get taught in a clinical setting just everyday things. So how do we help children identify when they're feeling stressed, and what can they do about that? And do they have to live with that feeling? How do they kind of access help? And so felt lucky in those sort of different settings early in my career. But I think more specifically, when I think about the real, maybe more prevalent or direct influences, I should also add, Dr. Taylor also gave me advice from my undergrad to my master's, from my master's to my PhD, and then my PhD into my doctoral degree. So often people will ask about, how do you get on a certain journey? How do you achieve things? And I always think you get people to help you. You find mentors. So I can go on about that. But one of the first people that made me really start thinking about clinical psychology was Dr. Jennifer Dungire at the Children's Hospital. She was a developmental psychologist, very behavioral in her approach, but just kind. She had a way of delivering challenging or difficult news to families in terms of diagnoses. Oftentimes, the diagnoses that were being conveyed were not just whether a child was on the autism spectrum, but also related to what that child's cognitive functioning might be and what that might mean in terms of their everyday functioning, their support needs over their lifetime. And she had such a good way of instilling hope with families, like, this is difficult news. Your child is perfect and wonderful. They're about to encounter a world that is not constructed to support their success. And so that means you as a parent will need to do, more work. But there are things we can do, and there's hope. And that hope also had to be tempered with planning. And I think that sometimes people can slide a little bit too far one way or the other, sort of steer away from the hope conversation and not recognize the gifts that children bring, even if those are different than maybe what parents expected. Or they may steer too far on the other side, which is, it's all fine, it's okay, and we're not going to have this difficult conversation. But parents need to estate plan. They need to prepare for potential long-term care for their child. So she really had such a lovely way, I think, of interacting with families that motivated me to move into that direction in my field. Then I worked with Dr. Adrian Perry, who I think is sort of the epitome of stealing from Glennon Doyle, but we can do hard things, but not only but we should do hard things. So if the universe is embracing something like facilitated communication, where it's an approach to communication that has led to significant distress for families, it doesn't allow people to express their own voice. It takes over their voice. It's had significant harm over the years. And Adrian stood up and participated in court cases and things to try to stop that practice. And I think she's really had a career where she has done some of the hard work in research and clinical practice. She's focused on those children and youth who have more significant language impairments, fewer adaptive skills, maybe more severe autism symptomatology. And the reason that's important is because many people don't do that research. That's a population of children and youth that we know less about, and that means we know less how to help them and their families. And so her work and advocacy in those areas, I think, sort of speaks to that we should do hard things. And I think she's just set a great example of volunteerism, that we are all probably at times regretful of our decisions to do some of the volunteer things that we do, but they're important. And I think that Adrian really set that example for many of us. And I can't talk about mentors and not comment on Dr. Andy Bondi, who's the creator of PECS. I worked for him for many years, and Laurie Frost, the speech-language pathologist, who's the co-creator of PECS with him. And certainly I think one of the big lessons I've learned from Andy especially as it pertains to behavior analysis, is that not everyone on the planet needs to be a behavior analyst. ABA can help everybody. It can make other disciplines, it can give them new strategies and approaches that enhance the skills they already have. I think some young behavior analysts want to convert everyone to ABA, and if we're not doing ABA, we're not doing the right thing. But he always had this approach that I really, really valued, which was that speech language pathologists know things we don't know. Occupational therapists know things we don't know. They don't need to be behavior analysts. But could we, with our expertise and learning, be a good partner to them in their work and their efforts? What can we learn from them? And I think his very common sense approach to we need to use the most evidence-based approach to help people, and often that is ABA, and we can rely on our colleagues in other areas to help inform our practice as well. And so I think that's a really important message.
Amazing. I totally agree with that. And you've had so many intersections in your career with different professions, and some of which you've even studied, that has, brought in this almost like it's harmony in terms of the application to individual clients, and helping to see things from different perspectives in order to support their needs. Really, that's, what makes it all great when you're learning from different disciplines and integrating it into your daily practices. One of the unique things that you bring, and you've talked about it a bit through your mentorship experiences, is the combination of clinical psychology and behavior analysis. Also very fortunate as well to have studied across both disciplines, and learned a lot from you, in fact, through that, including what you were speaking to about delivering diagnoses, and how to integrate, really important messaging about the child. One of the things I've took from you that I learned, and I still to this day, try to help orient parents towards is, this is your child, and all the wonderful things that your child has, and the characteristics and the gifts that they bring. That's who they are. The diagnosis is secondary to all of that. But at the same time, exactly, what you articulated is planning and thinking, and how do we help your child experience everything they're capable of, right? That's going to be the work. So it's the integration of both. From your perspective and your experience, blending the two professions together, what do you take from that? What do you bring from psychology to behavior analysis? Behavior analysis is a wonderful field, and arguably some people will say it's even a discipline of psychology. Some people will say no. There's different people, different. That's okay, but they certainly the two can certainly coexist very, very well. There are a lot of strengths from behavior analysis that I took through my education, but there's pieces that I go, oh, I learned that in psychology, and gosh, like working with my staff or any students that I've worked with, it's really important that you hear this. You might not see that in a behavior analytic textbook. Any thoughts on that from your perspective? What have you brought in from the world of psychology, or even anywhere else? People that you've learned from speech pathology from, or other disciplines too, that you think behavior analysts should hear, or maybe just think about when they're practicing?
That's a great question. I also think I bring a lot from human kinetics in. I think a lot of people would look at my resume or my CV and think this makes no sense. But this thread that's sort of interwoven through, I think, all of those disciplines or areas of interest for me is about behavior, and about the focus on using evidence to make changes for people that are valuable to them. And I think all of the disciplines share that overarching goal. There are different sort of nuances and approaches that people use to achieve those goals. I think maybe one of the things that I draw from in psychology might be related to family variables and family interaction. And I think sometimes we can get so excited about the technical components of behavior analysis, and we're very good at identifying the needs of the families and our direct clients, what maybe is making things harder for them, how we could make things easier and set them up for more success. And all of that occurs in their environment. And behavior analysis is really designed to focus on the environment and environmental changes. I think one of the things that psychology has taught is sort of the interactional nature between family members and systems. And if you're going to change one, that inevitably impacts the other. And then how do you prepare for what the impact might be on this person? And I can think of things like working with moms who had children who maybe were reliant on them for certain types of things, and those behaviors were their only connection. They were no longer developmentally appropriate. They weren't serving that child necessarily or the parent in sort of more developmentally appropriate ways, but they were fulfilling a different need for that parent in terms of interaction. And I think sometimes it's easy to lose those relational components. And so I think some of that from psychology, we have a bit more time to sort of focus on.
So, Julie, we were talking about, the impact that mentorship has made in your career and also considerations from all the different disciplines that you've learned from and how they all intersect to make a meaningful difference for, the lives of the individuals that we seek to serve. So now you're in a position, you've worked all this time and learned from so many other people, and now you're impacting the learning of the next generation and many generations of behavior analysts. So can you tell me about some times that perhaps have made an impact on you in terms of mentorship of your students or other clinicians? What's worked, shaping the future generation of behavior analysts?
Right. It actually is one of the things that drew me to my position at Brock University, that I was interested in mentorship. I loved supervision of clinicians in the community, and I really loved research and thought I would love the balance of working in a department where I could have the opportunity to clinically mentor young students and young professionals, as well as provide research mentorship. And I don't know that I find one more satisfying than the other. I love both facets of the job and of that position. I've been really lucky to work with brilliant young, almost all women, not all, but almost all. People ask me about that and I'll say I have the best job of all time. I work with graduate students. They've already sort of committed to this field, demonstrated how hard they're willing to work, and they want to work with people who have unique needs. And that is a really laudable career goal, I personally think. I'm a little bit biased about that, but it's a wonderful opportunity, I think, for me to be able to interact with people who are constantly making me think about things in different ways, learning new things, pushing the envelope. I think some of my mentorship opportunities that have been really pleasant or really enjoyable have happened years later. So right now I have a number of my own graduate students, and they are getting their supervised practice hours. So as you and many people will know that probably are listening, we have to get a certain number of supervised hours in order to become certified behavior analyst. And many of my current students are being supervised in the community by my former supervisees. So it's been really lovely to hear what my current students say about how positive their experiences are, how available their supervisors are to them. And I think that part of mentorship, of feeling like you're part of a chain and you can see sort of the growth in the field and you can feel like you've been, a part of it in some way. I think that's been really positive and lovely. And now I get to do research with some of my former supervisees, and some have gone on to academic postings or academic training sort of in the doctoral kind of range. And others were, as soon as they were done, they just knew, I absolutely want to start working right away and working with families. So I think it's been really satisfying just sort of seeing both. I value clinical practice and research. So I think seeing students and supervisees grow both ways. I think one of the moments that I had a bit of oh, that's lovely, kind of a supervision moment. One of my graduate students, who shall remain unnamed, when she was completing her master's thesis, it was focused on working with families in their home, addressing challenging behavior. And she had done an excellent job of conducting a family-based assessment where she really was in the home on a regular basis, working with them to identify what wasn't working for the child in sort of their daily routines, what was sort of causing some distress to the parents and siblings, and really trying to identify ways that we could positively intervene and set up a situation that increased everyone's success and happiness. But one of the strategies she came up with, and it would take far too long to explain why this was part of the strategy, but it did make sense, and it was based on the data, was potentially mom should pick her daughter up wearing her pajamas. To which I said, that's not an option. I said, even if it's technically correct, we need to do things that parents are willing to do. Yes. And I know this mom well enough. We have a multi-year relationship. I guarantee she will not be happy with your suggestion. Yes. And I know I disappointed the student at the time, and she had to think a lot about a possible next step that would keep the child just as successful, came up with a great plan. It worked. It was effective. All of that was great. And then later in her career, she was talking to me and describing how she was training other supervisees and how she thought it was really interesting to have conversations about how they would approach things in more home-based treatment, how they would train parents, and how she said, I can still hear your voice going, no, that won't work for the parents.
She learned something really that really impacted her career.
It's interesting because I do have a lot of research that is focused on caregiver training. And we do a lot of work on, yes, this is technically correct, and how will it feel for the family? And I think knowing that my students walk out with, I think, that appreciation, or we try hard for all of us to have that at the forefront of our decision making. I think when those windows kind of open up for me to see, like, oh, I think that is something that students in my lab and my supervisees kind of walk away with. I find that kind of a positive mentorship experience.
It's amazing. And the ripple effect, I think it's really important for people who may be watching and have some experience, in Ontario and even beyond. There's a lot of chatter about how do we build capacity? We don't have enough people, and what are we going to do? I mean, it's a bittersweet issue because it means that there are a lot of people who want to get help through behavior analysis, right? So this is amazing. Think about when we started long time ago. It was like a very unknown thing, and so what that means is people are looking to access something that will materially improve their lives. That's incredible. That's great. So then the question always becomes, well, what are we going to do? How are we going to get more clinicians? And there's all these little brainstorming sessions, for lack of a better way to describe it. And how are we going to what can we throw at this? Okay, what's going to stick to the wall to get more clinicians? And so for all those, like whether it's parents or professionals that are watching, or people who are involved in policy, I really believe it's the mentorship. This is like a grassroots ripple effect, and what can we do as a community to impart knowledge on the future generations, such that your example, which is a really good one, that they will also then impart knowledge onto other people. And that is really a gratifying, beautiful thing that many of us, and you've done this so incredibly well throughout your career, a lot of volunteer hours for that too, by the way. We talked about volunteerism. That is the gift, right? It's to be able to, it's not just service the clients that you service directly, but to be able to impart and have people, good behavior analysts, walk out the door. Like, it feels good to say, I had somebody that I've worked with, and they're really thinking about the family now. This is the answer, I believe, to all the capacity issues that we talk about. How do we encourage active mentorship within the field?
Especially in a field that is experiencing such significant systemic challenges. There are so many families on so many people's wait lists. And I think the guilt that a lot of clinicians carry And then we have this turnover in the field as people get pulled into, and it's great because people want the skills that some of our direct staff have developed. And so they may go to the education system, they may go and work in early childhood centers, and that's wonderful. But it's not necessarily wonderful for the families who have just lost their child's favorite therapist. And so I think it's really hard sometimes for people to think about mentorship when they're trying to address the needs of the families that are directly in front of them, compounded by the needs of the families that are directly behind those families on a wait list. And they're trying to do their best by their own staff, but they're short staffed now. And so mentorship within. So I do think that we don't get out of this without mentorship. And yet I think we also have to figure out how to support people to provide that mentorship. I've talked with my students about this, where sometimes they will experience, some disappointing experiences from their perspective in their supervised practice. And we'll sometimes talk about the difference between my role and maybe their community supervisor's role. And sometimes I have to clarify, like, I don't have a large clinical practice right now. You're my priority. You as my students are my priority. I can put all my time and attention here. But make no mistake, you would get bumped by a family. And so I think what's challenging right now is that clinicians are being forced with a system that's making them every day, make difficult choices with their time. So, and I'm not sure what the solution is to that, but I do think we have to build the opportunity for people in the field to rely on each other. I know you and I have done that historically. We have other colleagues that I know we both kind of share in common. I have phoned you to say, I've got nothing left with this client. I have done everything that I think is the right thing. And sometimes even just corroborating for me that you did all the right steps. And that outcome is actually a reasonable outcome given the complexity of the case. Sometimes you just need those other voices around. So I think that mentorship will be, without it, we're in trouble, but establishing it is difficult.
So, Julie, in your years of practice, you've seen the field evolve. You've seen it evolve in Ontario and even, to a large degree across North America. What do you think is important in terms of what we're currently doing in behavior analysis, the differences that we're making, and where should we go from here? Where should we keep pushing forward, doing better, asking different types of questions? Where do you see our field going?
That's a great question. I think that we need to continue to focus on providing really good services in the areas that have grown our field. So I think that the outcomes and the evidence for intervention with young children on the spectrum, I think that evidence base is something that should motivate us to continue to ensure that those types of services are available to children and families in the province. I'm worried there's been a big shift away from that. I think we're seeing some agencies not able to provide that, families not able to access it. So I think as a field, we need to be very confident about the fact that this is something that families should have. Children have the right to effective treatment, and we should advocate for that and support families to advocate for that. So I think that's one of those things that's easy to just sort of slide past, because at one point the province was the leader in the world for this. But I think that families would tell all of us right now, they're screaming it, that it's not happening for them. The families that want it can't access it oftentimes, or they can't access it within developmentally appropriate time periods as well. I also think, though, that we need to consider how we broaden our areas of practice. So I think what has made me really effective with many of the children I work with, many of whom have co-occurring diagnoses of ADHD, learning disabilities or various disorders. And I think I hear less about us working with other populations outside of autism. So I think we also need to remember that we have expertise and things to bring to the table for children who have needs in other areas who maybe have different types of diagnoses. They may have co-occurring diagnoses as well as an ASD diagnosis, or they may not, and we can still be really helpful. So I do think we need to consider how to gain breadth in our training, in our education, and to work to facilitate sort of growth in these other areas. That probably is a bit near and dear to my heart as well, given my background experience working on child and youth mental health units at places like McMaster. And I really felt like the fact that I was dually credentialed helped me be a better psychologist. And I can remember having some clients where people would say they're not treatment ready, which I was always confused by that. I wasn't quite sure what that meant, but would say they're not treatment ready, or we aren't having success at this time with these more traditional approaches. And it was often my behavior analytic approaches that could break things down. And I can specifically remember one family whose son had had multiple diagnoses from OCD, eating disorder not otherwise specified, generalized anxiety, depression, some other types of personality diagnoses. He was actually in a wheelchair despite no physiological assessment turning over any reason why that would be the case. And I started working with him, and he wasn't eating independently. He was about to enter high school, had been sort of a gifted child, athletic, and sort of his life had really kind of crumbled. And when we started working, we worked on a task analysis. How do we break down these small steps? And we worked on small steps in terms of both walking steps and in terms of taking bites of food. And we built the behaviors that allowed him to see his success. And then we could address some of the cognitions and the thoughts, etc. And I think that we have so much to offer in so many other disciplines. But I'm not sure if we're creating those opportunities or seeking them out. So I think I would love to see more of that. It's been positive to see the growth of acceptance and commitment training and people working on helping folks identify their values and engage in behaviors towards those values. I think those are all important movements. So I think there's both. I think there's a focus on what has been our foundation and not letting families continue to suffer from lack of effective treatment options. And then there's also we have many things to contribute to other areas.
Expand. I love the treatment ready part is like such an interesting piece that I think we bring to the table in whatever communities we work with, whether it's ASD or even, as you mentioned, so much beyond. Because whenever I've heard that too, many times in my career about different kids in different wherever they are at in terms of their skill development. And my first thought is always, whenever I hear that, I go, okay, cool, give them to me. Let's go.
Yeah.
Like, that's the amazing thing about ABA, right? Like, there really is no prerequisite. There's no like, you must have X, Y, and Z. We've talked a lot about PECS, this picture communication system. What's the prerequisites for PEC? Like, pretty much nothing. Want things. Like, yeah. So you're born with that. That's cool. Like, that's amazing that even beyond that, it doesn't matter if we're working with kids with autism or even beyond, right? The way that we look at things is, okay, let's just look at the individual for who they are and then teach them stuff that really matters. And so, yes, we can do that with an autism. And I agree that, of course, that's near and dear to my heart, that our continuous pursuit for the individuals we service, especially within autism, to be able to access evidence-based treatment is so important. Working with families, that's a partnership, right? Professionals and families working together to be able to say, we've got some really amazing things here that we feel that our community should be able to access. That's so important. But even beyond that, as you mentioned, right? Really being able to bring this notion of, okay, what can we do to help? That's it. You bring what you got. You don't need to come with anything.
We will meet you where you're at.
We will meet you where you are.
Dr. Bondi used to always say that the learner is always ready to learn. Are you ready to teach? It was sort of this approach to they're ready to learn, but you need to meet them where they're at. And do you have the skills to meet them where they're at? And I remember the client that I was talking about where people were saying not treatment ready, he was desperate to learn. He was desperate for remediation of all of these things that were impacting his life. His family was desperate. I remember when I started telling the family, well, this is what this is called. This is a task analysis, and we're going to, uh, prompt and support these behaviors and then reward this. And then he kept moving forward. And his mom just cried. And she had a doctoral degree and she kept saying, I researched. None of this came out. Why does no one know about you? And I remember thinking, that's one of the saddest things I've heard is no one knows about what we do. People have valid needs in their life, and they're not necessarily connecting that ABA might be sort of the solution to some of the problems that people face. So I do think we need to kind of keep the idea of people are ready to learn. We just have to meet them where they're at and be ready to teach.
Be ready to teach. Not only aren't they accessing the solutions, but the tragedy of when you go down that path, I think, and I've seen this with parents, I know you have too, is that they actually don't think there are solutions. So some of these families that we come across, that we work with, thankfully we come across them, but when some of the initial conversations are, well, you know, we've tried, like, he's just not going to be able to. He's just not. He can't. We'll just keep buying bigger diapers, right? Like, it's just, they're not going to be able to. We've tried that picture thing and he can't. He's just not, he can't figure it out. And like, what do we say, Julie? We say, like, give him to us. Like, can we just try one more time? Let's just see, right? And lo and behold, of course, it's work. Of course, it doesn't happen like the next day. But if you chip away at it and do it systematically and, you know, put your best foot forward in terms of what the evidence would suggest, right? Tailor it to that individual, then it's a complete about face. Like, those are really amazing moments too, when families, individuals, whomever, they go from like, I really didn't think that was going to happen, to like a couple months later, maybe a couple years later, who knows, depends on the individual. But you know what? Like, he's doing this. Like, he's really doing this. And you can see, like, sometimes they don't always say it, but you're like, you remember that conversation from months prior and you're like, or years prior, where it's like, and you really didn't think he would be able to, but he can.
Yes.
Right?
I had a parent tell me once, they came into my center and were carrying this old PAX binder, and it was dusty and dirty and probably had Cheerios smushed into the Velcro and dog hair on it. Well loved, well used.
It was being used.
Yeah.
Yeah.
And the mom, why she brought it in was because she was cleaning out cupboards and drawers and different things and came across this thing, and she said she's trying to pull it out. What is this old thing? And it was her son's old PAX binder. And the reason it was jammed back there was because he'd gone on to develop a very robust spoken language vocabulary. And, he could protest and argue with us and all kinds of other things. But she said, I remember not thinking he was going to get this picture-based system because other people had given us pictures and it hadn't worked. And one of the things that parents will often say is, oh, they're not interested in them. Of course they're not. We're giving this piece of paper and they're interested in jumping on the trampoline or jumping in the pool. And what does that have to do with anything that they want? And so we have to teach how these things are connected and how they're meaningful. And she certainly didn't think that was going to work. And then certainly didn't think there'd be a day when it was such an afterthought, this historical thing, like kind of coming across your child's soother, that it just wasn't a part of their life anymore. And so I think sometimes that idea of it can happen. And that's something I love about ABA, is that optimism, that positivity. And I think a lot of people don't know that. There's this perception that we change behavior and it's always negative behaviors. There's this connotation that we're reducing challenging behavior all day long. And that's very minimal for what most of us do on a daily basis. Even people who work in severe injury and severe problem behavior, their focus is like, well, this is happening for a reason. We got to build some skills. What do we do here? So I think the idea that behavior analysis is so positive, it just assumes that we can make a difference and that everybody's competent and capable. And There's a quote from Heward, 2005, I think. It's in what many of us would call the White Book by Cooper Heron and Heward. But the quote talks about the optimism of ABA and how we believe, why wouldn't we try to teach this person who can't communicate to communicate? Why wouldn't we change the environment to help young children be more creative? Why wouldn't I assume or believe that this person with a developmental disability couldn't achieve the same things that I can? And so we should try. We should try. We should, put the right things in place to support people. And I think that sort of optimism is one of the things I just love the most about ABA.
Yes. I think about that often because I've heard you say this in different contexts in different ways, and specifically from the book. Thank you. Thank you to the White Book. And because we often also get the question, what is ABA, right? What's it? And people struggle because we're very, and this is important, we're scientific, we're research driven. And so, we get really into the nuances of things. We have to, as professionals, to make it work. That's a different story. That's behind the scenes stuff though, right? So then you try, okay, guys, come on. We need to be able to sum up what is ABA, right? And I often think about, because I've heard you say this many times, it's optimistic. It's hopeful, right? That's really who we are as a field. We are optimistic, we are hopeful, and that's what drives meaningful change. Like that's what we're in the business of doing, right? And we help people and we believe.
Yes.
Right.
And it's interesting. I do an exercise when I used to teach foundations and principles, and now I don't really as much. I teach ethics, which is very sexy, regardless what anyone says.
Yeah.
But I no longer teach the foundations course. But when I first started teaching students in one of their first ABA courses, I would tell them this grandiose story, some of it's true, about my running expertise and how I am often training for half marathons, which is sometimes true, that I might run anywhere from 50 to 75 kilometers a week, which is sometimes true. Often it's on a trail, and those are technical trails, and there's hills, and they're hard, and I do it reliably, and it's this big part of my life. And how am I able to do this on top of having my position as a faculty member, doing at times lots of volunteer work, trying to remain present for my family and my friends? And inevitably, in the first class, everyone comes up with rationale and reasons that are about something inside of me, that I have some superpower, and I'm magical.
Yeah.
I have extra self-discipline. I have extra motivation. I'm some phenomenal specimen of human fitness. And they're all sort of looking for internal reasons. Yeah. And I think one of the challenges about those internal reasons is it suggests that only I could do it. Other people can't. And then I start to give them more information. I start to say, well, do you think the fact that I live on a property that has 2 trail systems that abut it, could that possibly make it easier for me to run trails regularly? People will say, oh yeah. Like, oh, so if you make things easier for somebody, it might make it more likely they do it. Oh yeah, I guess so. Then I'll ask them what about if I told you that I have dogs that really want to run, and if I don't take them, they bite each other's elbows all day long. They eat my shoes. And if I take them for a run, they don't do those things. So, and when I'm running, they're so happy and they look at me with love, and that makes me feel good. Is it possible that there's something in the activity that is sort of beneficial? And if I don't do the activity, there's something that's kind of punishing, like my dog's eating my shoes. Could that make it more likely that I'm going to run? Yes. I have a husband who happens to have a job that allows him to do most of the laundry, the groceries, the household management, all those types of things. So I don't have to do that. Is it possible with fewer competing priorities I might be able to run? And I sort of set the stage that this isn't about me and me being superhuman. And if you only look inside people, you can't change that per se. I mean, there are ways that we can sort of facilitate motivation and have people focus on their values and identify those things. But from the perspective of really behavior analysis, we're focusing on, where is this person at? What are the components of their environment that maybe make this harder for them? It's a really valid goal that they have. They want to, I don't know, be more independent at school. They want to write better. And and so how do we change the environment to support that? How do we create the conditions that can help them versus sort of make it sort of feel like an uphill battle all the time? And I think that's what people don't get about ABA is that it really can help people identify those goals, approach them in a way that's positive, and achieve them without having to develop some superhuman power or just innately be born brilliant, smart, with good language skills and all these prerequisite skills.
Yeah.
So there's my diatribe about
That's good. That's
about
really
ABA.
good. Look, it comes back to everything that you just said. That gives the optimism to it, right? If you're thinking about it like that, you're not thinking it's something like inside that's something that either you got it or you don't, right?
Yes.
If you approach it as, well, if I can change some stuff, better things will happen.
Yeah.
Then that what does that lead to? Like the endless possibilities of what people are capable of.
That's right.
So that's just it's an amazing thing. Yeah. I have to ask because we've talked about the intersection between psychology, ABA, and all the different roles that you've played in your career, and some of those involve diagnoses. And we have families that watch, and are trying to figure out the journey at different stages. Some may be actively involved in ABA treatment, some may not be. And certainly there's a lot of families, and we know this even like early on in our career, where you're early in the diagnosis phases, either you suspect or there's a diagnosis, and you're trying to figure out what to do, right? Yeah. And now we say people Google it. Back then, I don't know what they were looking at. It's unbelievable, like the resources that parents will have, right? When they're trying to figure out answers. I say parents a lot because this is the population that I work with, but anybody who's having challenges and trying to figure out what are the solutions. So, for a family, especially for children with autism, and they're in those stages of the diagnosis, and they're trying to figure out what to do, what would you offer to them? What would you say to them, knowing everything you know in your career?
I think what you mentioned before still holds true for me, that I always want to remind parents about all the gifts that their child brings. And those might be different than they expected or planned for. And yet my experience and interaction with families suggests that the other gifts their child has bring meaning in so many different ways. So I think holding that piece, I have several very close friends who have had children who, when they've been in the process of getting a diagnosis, one of the things that I think we've talked to each other about is them trying to remind themselves, me trying to support them, that don't miss the joy in the moments right now. It can be so overshadowed by this other concern. So don't lose all that's lovely and wonderful about this lovely little human that's part of your life. The other part that I would say is actually draw on a little bit of what you learned when we all had to sit through public school or grade school and high school science. So parents should not have to be researchers. We know how painful the process of completing graduate school can be. Not every parent should have to do that. But I do think there's a certain amount of healthy skepticism and just those early kind of things we learned about science and decision making that I would encourage parents to try to keep in mind. So if something sounds too good to be true, it probably is too good to be true. If something sounds like it's very easy and it's going to fix everything, well, if something was easy, all of these parents that we work with, they would have figured it out. If it's going to fix everything, I don't think there's anything on earth, when I think of medical treatments from sort of my background in kinesiology and human kinetics, when I think of psychological treatments and mental health, there's nothing that fixes everything. So I think anything that overpromises, parents should have some skepticism about. I think it's really easy to fall into anecdotal evidence and individual stories. And I love Adam Grant. He's an organizational psychologist. He has a podcast called Rethinking. And he recently had a small breakdown, I think, in his own episode when he was commenting that people look for the individual story. They look for a biography and they go, that's what I want. So that's the thing I'm going to do. And his concern is no, no, no. We know better. That's what social science is about. That's what research is about, is we don't look for one. We look for the preponderance of evidence that tells us what's most likely to be best for this individual for this reason. And not just going, well, this was good for one person, so I'm going to try that. And I think a lot of parents, people try to kind of present those things to them. And I think taking a little bit of a step back and going, wait a minute, my neighbor smoked until they were 90 and they lived till they were 90 and smoked multiple packs of cigarettes a day. That doesn't mean that smoking multiple packs of cigarettes a day because it worked for them is a good idea. The preponderance of evidence would tell us it's not. So I think, so those would be two of my suggestions for parents. If it's too good to be true, if it overpromises, be skeptical. If you're being kind of finding yourself really drawn to individual stories, be skeptical. Consider the quality of evidence. I think we all had to do things when we were in science fairs. And I can remember having to, try to prove that something caused something else to happen. So we were thinking about things like, what's the quality of the approach to get to that answer? And then what's the nature of change? So I've heard a lot of people say, oh, this is evidence-based. There's one story, there's one study about this. And I think I really feel for parents in the face of the term evidence-based. I think it's so important that we understand it, but evidence-based is about that there's a sufficient number of studies or replications of effect. So lots of different people have repeatedly shown this to work. And so that's sort of the quantity piece. And the way that they found the answers was reputable and rigorous. So the quality piece. So I think really, again, shying away as parents from like, I know there's one study, but have there been other studies? What have other people found? And sort of trying to kind of not be a research scientist, but taking a bit of a step back and thinking, wait, I do know how to kind of apply some of what I've learned in public school, high school, or maybe in their own undergraduate, graduate educations and applying that to their sort of decision making.
That's good. Because, when I talk to parents when they've recently received a diagnosis, understandably so, but I hear from many of them, they feel the need to move. Like I got to do, like, I'm calling you today, this call, he needs to start tomorrow, right? Because I need to do something. Eh, Like, it's understandable that and yes, you should do something because you can't just sit there and be hopeful like that's an important piece, but to also take action towards, you know, having your child live their best life. That's very important. But the rush of like, I gotta do, I gotta go, I gotta go now can lead to going down the wrong road, right? You haven't fully evaluated your options, you haven't considered. And like you said, and I'll say this too, like, and I really feel for families, even as I'm saying it, I'm like, gosh, I'm listening to you too. It's like, this is a lot of work. Okay, this is like, we're not going to sugarcoat it. Yes, you have to, we can, as professionals, you can speak to professionals who, have had distinguished careers and are well respected in communities, and they can help guide you should you be so lucky, to be able to find them because it depends on where you live and, all the other stuff. But that it is the challenge of sifting through stuff, right? But it's also okay. It's not that you're not going to take action, but it's okay, like you said, take a step back, digest the information, ask questions. The skepticism is the ability, and you should be able to, even on the individual level, as you're sifting through the stuff, if you're considering different providers, whatever that might look like for your child, you should be able to ask them questions too, right? I welcome questions. Families ask me, I'm like, I'm so happy to have those conversations with you. They're important. And I see where you're coming from and what matters to your family, but you should ask me about how do you know my child's going to progress, or how am I going to know my child's progressing, or what is this going to look like, or how long is this going to last, or ask me whatever's on your mind, right? It's really important, and that does take time. So that's, really good advice for families is to consider all those things. Just you're not putting the brakes on forever. You're not shutting down the engine. You're just
Taking a pause and then thinking through the information critically.
yeah, absolutely. So that's from the family's end. We also have other people that are starting out different paths in their lives, which are what we've talked about a lot. Students, clinicians, you've worked with many of them. You've helped set them onto their careers to come, and you intersect at different points where you might not see them for a while, and we see them at a conference or whatever. It's super cool to see where different people are at. What would you say to people entering into the field, or what do you look to impart on students? What's important for new professionals to think about and keep in mind to drive them into their careers?
I have three things that I've realized over time have been important for me, I think, in supervision and in interaction with whether it's clinical supervisees or students or just other kind of people in the field who are maybe earlier in their career. I think the first thing is we will all talk about the importance of physicians and people in medicine of knowing the science and keeping up with what is current, what's changed, and being technically strong. I don't want to have somebody recommend a treatment to me that is something that is outdated and we would have done previously. So I think it's really important for our students and young people in their careers to be aware that what they learn now is not necessarily going to be the same thing they're doing in 5 years, and to stay on top of that to get really solid technical skills. However, I think we all also know doctors who are brilliant technically and have horrible, what we would call bedside manner. And we don't want to go to see them. I have a girlfriend who is a sport med doc. She has saved me on multiple occasions, the weekend warrior that doesn't give up any of their activities and continuously ends up hurt. She has repeatedly found injuries that were improperly diagnosed, not quite given the treatment plan that would work. And often that has to do with her bedside manner. It's her interpersonal skills. We are often, as behavior analysts, only as good as the data or the information that we have. We are often not the people implementing the interventions directly. We're often asking parents to. And so if we do not have strong interpersonal relationships with either the parents that we're asking to implement things, with the staff that we're working with, then it doesn't matter how strong our technical skills are. So I think young career professionals need to consider that both of these things are critical. We also know that parents are willing to trade off quite a bit of treatment efficacy or effectiveness to have a clinician who they build a strong rapport with, who they think is a good listener, is empathetic. And so if we want parents to really reap the benefits of our interventions, then we need to have both sets of skills. So that would be my first thing, is to attend to both of these sort of tracks. The other is, I think people really get focused on the techniques of behavior analysis. So I want to learn how to do this technique and I want to address this thing. And they forget about probably one of the most amazing things that we have at our disposal, or tools that we have at our disposal, which is single case research design. And by being able to actually put some interventions in place and then manipulate sort of how we offer those under different conditions, change something in a small way, it can allow us to really tailor our interventions to the specific needs of that specific individual that we're trying to help. So I think about people often ask me for PECs in particular, are photographs better? Are symbols or cartoons better? And the answer is, I don't know. Depends on the learner. The research is really ambiguous about this. And so through single case design, I can do things like introduce a variety of pictures of both types, take data on both, make sure they're equivalently exciting to the communicator, and then figure out, they will tell me which is better for them. Do they understand the pictures better? Or are they more accurate in their discrimination and their use of the pictures if they're photographs? So I think that we overlook this as something, or at least early career behavior analysts sometimes look at this as this thing they have to get through versus a core element in their toolbox. I think it's also one of the ways that we can allow our clients to vote on their own treatment, to vote on their own goals, and to vote on their own preferences, and to share them with us. So I've done a lot of work around, great, we taught a picture-based communication system. I think they're kind of ready to move to a tablet-based system, something that has speech-generating qualities, so it can talk. We don't have to worry about Velcro. We're not losing pictures, all these great things. But I don't know which is better for this human in front of me. And so by putting them both into sort of treatment and monitoring the data and keeping many things equivalent, it allows that person to tell me which one of these things they prefer, which they're better with, more proficient, more independent with, and they have a voice in, and not, no pun intended, they have a voice in their own treatment. So I think I would hope our graduate students and early career clinicians can start to see that research design isn't about research per se. It's about experimentally sort of evaluating what we're doing. And then my final just thing is find a mentor. Work with people who can bolster you when you feel like you've run out of options, who can tell you the hard truth sometimes about there is something you should have done. You need those people in your life. So if you're going into private practice in particular, you need other professionals who understand the ethics, the legislation, and all the requirements for something like running a business. Yeah. If you're going to work with complex cases of clients who have multiple co-occurring diagnoses, you need mentors to make those transitions. And wherever we are in our careers, there will always be the need for either more advice, just simple bolstering when we feel low or down. So I think finding a mentor and really continuing to reach out to that person, have dinner, go for a coffee, those types of things.
Absolutely. Phone a friend. You always need to phone a friend. Like, you never know when you're going to need it either. So, the ability to know what you don't know, and then to be able to find somebody to help you, it's game changing. And it keeps you going too. Like you said, it's the sounding board, it's the boost sometimes you get into these, you get into this spot and you can't see a way out. And there's somebody there that can help you with that. Not just for your clients, but also even just for yourself, right?
Right.
As a professional. That's great. That's really
need
good advice.
Not to burn out.
You need people to not, yeah.
I think that's part of it.
Yeah, absolutely. Yeah, having other people there to help you. So excellent advice. Really, thoughtful in terms of where professionals can go to keep their career going and evolving. Last question, Julie.
Yep.
We've talked about parents, talked about professionals, students. For the world, what do you want the world to know about ABA?
Well, I think I ruined my answer before by already talking about the optimism and the positivity. But I think the way that ABA plays a role in my own life is that it permeates all the facets of my goals. Or all facets of my interests. So whether it's related to health goals, eating a certain way, lots of us have family histories where we have concerns about our blood pressure or being at risk for diabetes. Yeah. And I think I use ABA as a way to sort of build the habits and reinforce certain types of behaviors and reduce unwanted behaviors that aren't in line with my health goals. And that could be sort of nutrition-based, could be stuff that my doctor's encouraging me. So there's this whole world of behavioral health as well. Whether it's running or my own kind of preferred sort of part-time or leisure time activities, I guess, those are areas that I think ABA is incredibly helpful for. I'm currently reading a book from Cassie Holmes called Happier Hour that's focused on really thinking about time affluence and time poverty and how do we use our time in a way that brings us happiness and that we are devoting our time to the things we want to be doing. And she has a checklist for every half hour rating what we're doing. And I'm reading this and I'm so excited because it's the opportunity for me to take data on this important thing in my life, which is I only have so many hours in a day. I have only so many walks left with my dogs, only so many days left with my husband. And many of us, I think, kind of in the same kind of age cohort are probably thinking only so many days with our parents or children before they go to university. So, how do we want to spend that time? So, I think for me, the natural fit is, oh, taking data and using what I know from behavior analysis is how I would ensure that I'm meeting my goals related to my own kind of personal fulfillment and values. So I think what I would like the world to know is that ABA isn't something that we just use to address challenging behavior. It is not specific to working with people with various neurodevelopmental, developmental, intellectual disorders. It is for everyone. And I know that sounds kind of silly, but it really is, I think, this it's a science that helps us as humans sort of achieve the things that we want.
Amazing. It's so powerful. ABA is so powerful, and it extends to every facet of humanity, really, at the end of the day. So it's a beautiful thing to consider and think about, and how we can all, as professionals, make things better in the world using this wonderful science that we have. And you've done that throughout your career, 20 years plus now. And we're so grateful to you, Julie. I am. Personally, you've impacted me in my career. And yeah, and it's been a wonderful journey. Every single student, clinician that you touch is so blessed and lucky to work with you. And we're so fortunate to hear from you today and learn from you. Thank you for being here, and thank you for everything you do, Julie.
You're welcome. Thank you. I'm glad that you've created this forum for people to learn more about ABA.